Hi, I'm Amy Finley, and this is Across the Fence. One of the amazing things about hosting this show is how often a guest makes me think about a topic in an entirely different way. That's the case with my guest today, Dr. Heidi Schumacher. Dr. Schumacher is a pediatrician at the UVM Children's Hospital and an associate professor of pediatrics with the UVM Larner College of Medicine. She also happens to be an alumni of the UVM Larner College of Medicine. She's also a member of the American Academy of Pediatrics Council on School Health. Okay, so you hear all that, and I bet you think we're going to talk about keeping your kids healthy, and in a roundabout way, right, we are today. However, our actual focus is going to be on absenteeism and its impacts on student achievement and long-term health outcomes. Dr. Schumacher, thank you for joining me.
Thank you for having me.
Okay, so could you start off by defining absenteeism for us? What is absenteeism?
Yes, absolutely. So
I
first
feel
of
like
all,
parents think we know what it is, but maybe we don't.
that's right. Well, first of all, happy back to school for
Yes,
everybody.
happy back to
Exciting
school.
time of year.
It
I know
is.
my kids are excited to get back, but maybe a little rusty on our routines in the morning.
Yeah, it takes a while to get those routines snapped back into place.
That's right. But we're here because we know that being in school every day, attending consistently really makes a difference for kids, for communities, for teachers, for families. And yet almost all of us miss a day here or there. So I'm excited for this discussion to talk about how much is too much missed school, why does it matter, and what can we do?
Yeah, well, okay, so that's a good, define too much? What is too much?
So I think a lot of folks know the term truancy. That's
Right.
one that I certainly remember from being a kid, and as a parent now I hear that word a lot. Truancy talks about unexcused absences only, and most of us think about when a kid skips school, truancy.
Yeah. Okay.
Families might think about that scary letter they got from their school that says you missed, your kid missed 10 days. If you don't get them back to
The
school.
ones that you didn't know about,
That's
the ones
right.
that take you by surprise as a parent.
That's right,
Okay,
and you're
that's
going to go to
truancy.
court. So that's
Okay.
truancy.
Okay.
But increasingly we're thinking about instead not just unexcused absences, but any absence really matters. And so we're using a term called chronic absenteeism, which counts any missed school for any reason, excused or unexcused.
Okay.
And it's defined as missing 10% or more of the school year, which actually adds up to only about 2 days of missed school a month.
That is kind of a shocking number because 2 days of missed school a month, I'm a parent, I can remember that there were times when probably 2 days a month were happening kind of frequently. I mean,
That's
is
right.
that kind
and
of
it's,
real in the
I
lives of
think it
parents?
sneaks up on people. People
Yeah.
think, oh, 2 days a month. But, maybe it's grandma's birthday, maybe
Right.
it's a day out sick, maybe it's a day for a sports event.
Yeah.
But only 2 days a month, really, over
So it-
time, we know the
and it can
impact
get away
adds
from
up.
you. Okay. And so what happens when kids miss too much school? What's the
So
impact?
we see the impact both in the short term and the long term. So even kids who are chronically absent, again, 2 days a month missed in kindergarten, are less likely to be reading on grade level in elementary school.
Okay.
When we get to the older grades, kids who are missing 2 days a month or more in middle school and high school are less likely to graduate from high school,
Okay.
less likely to have a higher paying job.
Okay.
But I'll say it's not just about academics. We also know schools are a major place where kids get access to healthy food. So
Okay.
breakfast and lunch in the school setting, sometimes healthy snacks.
Okay.
Kids there also are maybe getting mental health or other health services. They're making friends, they're finding mentors, and they're getting connected with activities that they love too that might really inspire them to stay connected in school and beyond. So it's sort of a big, holistic picture of what you get to experience at school. If you're not there, you can't access that.
Right. You can't get the knowledge, you can't get the learning, but also it sounds like you can't get these incredible experiences that are also an integral part of the school
That's right.
process. Okay. So is the issue when we're talking about absenteeism, is the issue a child who is sick too often, or is it about a child who doesn't want to go to school? Are these, these are different sides of the same coin perhaps. Like what are we talking about?
That's right. I mean, there's lots of reasons why kids miss school.
Yeah.
Some of them preventable, some of them less so, but illness comes up a ton. I'm a pediatrician. We hear lots of questions from families. Well, my kid was sick.
Yeah.
They had a fever.
Because-
During coronavirus, right, we
Yeah.
couldn't go back to school for a number of days after that.
And there's a lot of protocols around when to send your child to school if they are sick. We don't want to send sick kids to school. So we're not telling parents to send their sick children to school.
That's exactly right. We're not telling parents to send their sick kids to school, but we also know that in many cases, parents trying to do the right thing, keep their child home maybe for longer than they need to be during an acute illness. So I always encourage folks, if you have questions about when is okay to go to school during or after an illness, you can always reach out to your doctor, your school nurse, another member of the school or healthcare community to ask.
Okay.
We also know that kids have chronic medical conditions, so things like asthma or allergies or even dental pain can be reasons that kids miss a lot of school. So again, I always recommend folks stay in touch with your doctor, with your school nurse, if you have questions about that.
Okay, so there's a lot of different reasons why kids miss school. And some of these are some of these on the social side as well?
Absolutely. So there's illness is one big bucket. I think that's where folks' brains go to first.
Yeah.
But we also know there's a ton of complexity in the world. Caregivers may be sick. One child may need to provide child care to a younger sibling who's sick, so mom or dad can go to work. Transportation is a challenge, especially for our more rural communities who may rely on a school bus. They miss the bus, they don't have a car that works. It's really tough to get to school. Lots of other sort of social considerations.
This is why I was saying that this topic made me think about this in an entirely different way, because we think just of missing school in these, as a parent, these very simple reasons. My kid woke up, they said they had a sore throat, I didn't send them to school, but now we're starting to think about all of the other reasons why that's true. We missed a day here, we missed a day there, and the way that all of these things start to compile and add up.
Absolutely. And the other thing is, think about it, if you're a child in school, you've been sick, let's say you have a serious medical condition and you've missed a number of days of school for that. As you start to fall behind, we also know those young people tend to feel less connected to school. They're nervous about the classes. They don't feel like they're succeeding, so then they feel less confident. They might lose connection with their teachers or their friends. And so we find that there's a bit of a spiral effect too. So I love that we're having this discussion in September, because this is a really nice time to build some routines.
Right, so begin as you mean to go on, being aware of it. What are some red flags that parents might pay attention to when it comes to absenteeism? It's
a great question. So I would say generally, again, this is a great time of year. We know that routines, even in the first few weeks or month of school, can really make a difference over the course of the year. If kids miss 2 or more days of school in the month of September, they're 5 times as likely to be chronically absent over the course of the year. So this is the time, I say this to myself as a parent, this is the time to build those routines, to connect with your young person too and say, what do you love about school? What motivates you to get there, right?
Right, having those conversations about all the reasons they want to go to school.
Exactly. And ideally on-time arrival, right? That first period makes a difference. So trying to build routines, trying to build positivity in it. And of course, staying connected. If a parent hears from a young person, they have concerns about school, it doesn't feel relevant. That's something we hear a lot from older students. If they're concerned about bullying, anything else in the school setting, I always encourage parents, please don't wait until it becomes more of a problem. Contact the school right away.
That brings to mind something I was wondering about. Is it more of a problem at any particular age, or is this something that parents of children at all ages should be thinking about?
It's definitely something that parents of all ages of children should think about, but we do see a spike in the youngest grades, kindergarten and early elementary. Folks think that's maybe because, and I've been guilty of this myself, when your child is 5 and in kindergarten, if they miss a day here or there, does it really matter? And the answer is yes, it really does. They are learning also, it's setting routines. But we see a spike in early elementary, and then we see another spike in middle to high school.
Yeah, so you're changing my perceptions, because I would have thought maybe it was more problematic when they were in middle school, high school, but you're saying actually really we're thinking about those patterns from the very first few years of school. So let's back up a minute. So you're a pediatrician, and we're having this deep conversation about school and school performance. What is the connection for you? How did you become so concerned about this issue, so passionate about it?
Yes, I do love this topic. So I used to work in a school, and I work now very closely with schools here in Vermont. I think fundamentally the reason why it's such a passion for me is because we know that healthy bodies and minds are the foundations of academic success. We also know that success in school is actually one of the leading predictors of long-term health.
That was fascinating to me. So tell me more about that.
Yeah, so we know that when young people are engaged in school throughout, they're learning, they're growing, they're learning how to interpret information, how to think critically, they're learning about healthy behaviors, they're getting physical activity. and they are positioning themselves to make healthier choices in the long term. We also know that kids who graduate from high school, and even more so those who go on to additional education, have higher paying jobs, more access to health insurance and things in the future. And so it seems like kind of a long leap from school attendance in kindergarten to long-term health and well-being, but it is there. And so I feel like as a pediatrician
and as a parent,
I can help my patients address some of those health or social factors that might be making it hard to get to school. But also, if I want to achieve my goal to help my patients thrive throughout their lives, I have to attend to their success in school just as much as anything else.
And so one of the ways you're doing this is you're involved in the Everyday Counts partnership. Do you want to tell us a little bit about that?
Oh, I would love to, yes. So this has been an incredible project we've been working on this year. We got a generous grant from the University of Vermont Leahy Institute for Rural Partnerships. We're about halfway through that grant award now. And it's allowed us to really think about how we lift up partnerships between schools and healthcare practices to support attendance, exactly what we're talking about here. Because we know that many of the kids, especially in our more rural communities, the same kids who go to the school in town, often many of them go to the doctor in town. And so figuring out ways that we can test models for the schools and the healthcare together to promote attendance and its importance, to respond when a child misses school, ideally not too far downstream, but really kind of in real time, has been just tremendously exciting. We have 4 communities across the state that are part of it. We're also working very closely with state government about state level systems, and we're engaging a lot of UVM students in this work too, which is super fun for me to help folks early in their careers to be thinking about cross-sector work as just part of how we do public health.
And attendance as a pediatric vital sign.
That's exactly right.
Absolutely. Okay. So when parents or caregivers are in your office and they're concerned, what do you tell them? What tips do you offer?
My first wonder is always to be curious about the child's experience. Back to what we were talking about before. What do they love about school? What motivates them to get there? What do they want to do in their future, and how can we try to figure out how success in school can help them get there? I also wonder with them about what they don't like about school, or what hinders them from getting there on a daily basis. And then we really talk about specific numbers. I ask every patient that I see, how many days of school did you miss in the last month?
So these are very meaningful conversations. You're really getting to the root in the office.
We try to very much, right? And if they say they've missed 2 or more days in the last month, then we go real deep.
Then it's a flag.
And we talk about, what were some of the challenges and how can we address those?
Yeah, and we actually have some resources for parents. If you could use more information on successful back-to-school strategies, the American Academy of Pediatrics has some helpful resources available. You can check out the website listed on your screen. Obviously, Dr. Schumacher, you and I could talk about this all day, parent to parent. Thank you very much for joining me. Appreciate it. And as always, Vermont, thank you for joining us. And thanks to the team that makes Across the Fence possible. I'm Amy Finley. This is Across the Fence. Come back and let's learn and explore again tomorrow.